making healthcare affordable, accessible, available to all. It's not in those days where there's none. You need to get a van to provide specialist surgeries, and you leave within 2 hours, something happened to somebody. Where would be the vans to go and take care of them? Those are stopgap measures, and you should prioritize Agenda 111 and not that of the Onuado one, which is just a temporary measure. Mr. Speaker, there is the network of practice by the Ghana Health Service, and that is allowing for all specialists to be attached to CHIPS compounds, health centers, polyclinics. And this policy must be strengthened. But Onuado saying that I will drive through with specialists, take care of you, drive back, go and sleep. Whilst the other policy is we are attaching specialists to you, and you are going to compete Onuado with this. I stand to be confused with this resetting. And this is not the best for this country and must not come on.
Let me come to Honorable Dr. Ayew, Afriyie. Doc, you have 10 minutes.
Yeah, Right Honorable Speaker, thank you for allowing me to take my time on the motion to thank the President. I was on page 4 of the order paper, in line with the Constitution provision of Article 67 and the Standing Order 72. Mr. Speaker, as this is the first address by the President, I would want to touch base with the manifesto of the NDC, which would actually influence the direction of the budget. Mr. Speaker, if you go to the manifesto of the NDC in page 108, touching on sustainable funding for health services. Mr. Speaker, there are 6 pillars of health systems that governs and runs health systems all over the world. And financing is a very critical one. And that is why I stand to use the manifesto of the NDC in page 108. Mr. Speaker, I said, the next NDC government would explore innovative and alternative ways of funding the health sector and prioritize allocations by establishing 1, the Ghana Medical Care Trust Fund to support the cost of care for persons with chronic diseases such as kidney failures, dialysis, cancers, and heart diseases. Number 2, to decollateralize the NHIA and ensure the total revenue 100% is given them. Mr. Speaker, conspicuously missing from the President's State of the Nation address was number 2 of his own manifesto promise, which is to uncap the NHIA. I have a strong feeling that something is changing, and nobody spoke about it, because healthcare finance is a very topical issue, and for him not to have mentioned number 2, but touch base on number 1, I'm looking forward to a certain inconsistency, and somebody is trying to play smart or act smart, and definitely eyes are watching. Now, Mr. Speaker, I go back to the item 1 on their manifesto, which is establishing the Ghana Medical Care Trust Fund to support the cost of care for persons with chronic diseases such as kidney failure, into bracket dialysis, cancers, and heart diseases. Mr. Speaker, do we need to establish a medical trust fund to look at these diseases, or a medical trust fund to raise funds to support Medicare in terms of health financing? Mr. Speaker, listening to the President, his emphasis was non-communicable diseases. Mr. Speaker, may I say and put on record that the vote on account or the expenditure in advance of appropriation that was done in this House took care, a budget of 57 million, that will take care of all dialysis patients in this country. Now, the estimated cost of care was between 20 to 57, but the minister provided an upper ceiling, and that was because the pricing unit of NHIA has made recommendations in September, and it was approved by the board. And so, if you are going to establish a trust to be able to finance dialysis, which has been provided for already, I stand to say that this is an error, and this resetting is dangerous and cannot be tolerated and cannot be done. Mr. Speaker, may I go also to say that it's provided for heart diseases. Heart diseases are already indicated in the budget, in the NHIA benefit package. And therefore, I don't get why there must be a need for a Ghana Medical Trust Fund and which is already being financed. In terms of cancer, Mr. Speaker, breast cancers has been included. In those days when they were in government, there was none. Whether the resetting will mean they will take it off, I don't know. But breast cancers is being taken care of. Cervical cancers is being taken care of. Mr. Speaker, all the 4 leading causes of death of cancer for children has been taken care of. I don't know what this medical trust will do because it's already in the package. Mr. Speaker, may I go to Agenda 111? The President said 3 of them, is it 1 or 3 is operational? Mr. Speaker, in terms, none is operational. Mr. Speaker, for all those not operational, they need staff to be posted. The responsibility of posting of staff is not with us. It is with you. You have to post staff there and get it operational. Mr. Speaker, between Swami to Bole Bamboy, those days when the former president was there was only a micro or a mini clinic that was in Bole. Mr. Speaker, on that stretch from Swami to Efija Kwabre, Offenso, Wenchi, Bole, Wa, there was only a micro clinic. By virtue of the Agenda 111, there is a project ongoing in Swami, in Efija Kwabre South, in Efija Kwabre North, in Offenso South, in Offenso North, in Techiman, in Wenchi, and even in Bole Bamboy. Mr. Speaker, we are talking about financing. 400 million has gone into it. Yes, 400 million of dedicated financing from ABFA. ABFA. But you are saying that the private sector should take care of that. Mr. Speaker, they must demonstrate commitment to financing from the budget. The same ABFA that the NPP use, they can also make an allocation in this budget from ABFA. Apart from that, may I say, you go for concessionary loans. You are asking for PPP, which is good. I am into the private sector in healthcare financing. If you give me the opportunity, I'll take the juicy ones in the capital cities. What will happen to the rural folks who need healthcare the most? That is what I'm talking about. Mr. Speaker, there is no option than the NDC government, led by His Excellency John Dramani Mahama, to make some provision in this budget from ABFA to continue Agenda 111. Mr. Speaker, Agenda 111 or Onuado healthcare, as in the budget page, as in the NDC manifesto, page 104, is no substitution for Agenda 111. Mr. Speaker, the Onuado vans, as in the manifesto, is allowing vans to go to deprived areas to provide specialist care and co. This is contradictory, extremely contradictory, to a permanent measure of providing healthcare in all areas. We're talking about universal healthcare coverage by 2030, making healthcare affordable, accessible, available to all. It's not in those days where there's none. You need to get a van to provide specialist surgeries, and you leave within 2 hours, something happened to somebody. Where would be the vans to go and take care of them? Those are stopgap measures, and you should prioritize Agenda 111 and not that of the Onuado one, which is just a temporary measure. Mr. Speaker, there is the network of practice by the Ghana Health Service, and that is allowing for all specialists to be attached to chief compounds, health centers, polyclinics, and this policy must be strengthened. But Onuado saying that I will drive through with specialists, take care of you, drive back, go and sleep, whilst the other policy is we are attaching specialists to you, and you are going to compete Onuado with this. I stand to be confused with this resetting, and this is not the best for this country and must not come on. Mr. Speaker, may I go to primary health care?
Dr. Ayew, your time is almost up.
Okay.
So wind up,
in the manifesto, they said primary health care, free primary health care. What is free primary health care? NHIA is already financing and taking things for free. So if it is free, on cap, if you uncap, just like the NPP manifesto for free consultation, we stated we will uncap and we will make sure nobody pays any premium. Those informal sector will not pay. That is free. So if you are saying free, what does it mean? People are doing co-payment. If you want to eradicate co-payment, then provide the full funds of uncapped funds to them, and there will be no co-payment, and that is free. Otherwise, are you providing free meals at OPD? Are you providing transportation at OPD? What is free? There is no, it is tautology. Already the NHIA is looking at erasing financial barrier. You are also saying free.
Thank you.
What is the meaning of this?
Thank you.
Mr. Speaker, I thank you for the opportunity.
Thank you, my brother.
I know during the debate in the budget principles,
we'll give you more time.
Thank you so much, Mr. Speaker. Thank you.
Very well. Honorable members, let's now turn to Honorable Rita Na Odoli. Honorable, you have 10 minutes.
Thank you, Mr. Speaker, for the opportunity to contribute to the debate on the State of the Nation address by His Excellency John Dramani Mahama. Mr. Speaker, before I continue, permit me to quote from the State of the Nation. His Excellency John Dramani Mahama, page 5 of the State of the Nation, paragraph 6, to be precise. His Excellency said he was inspired by the Almighty God and propelled by the massive mandate given me by the good people of Ghana. He made a statement that the NDC administration fixed Dumsor before we left power in 2016. And he made a purposeful, bold declaration again that I, John Dramani Mahama, will fix the economic crisis confronting our country and reset it on the path of growth and prosperity. Mr. Speaker, His Excellency John Dramani Mahama, on delivering the State of the Nation address, was very truthful to Ghanaians on the state of the economy. And he did not come here to lament, but he came to promise us that he will fix the nation and the Ghanaians who voted for him will be happy again. And he will reset Ghana. Mr. Speaker, on gender inclusivity, His Excellency John Dramani Mahama is committed to working with women, and he demonstrated it in appointing Her Excellency Professor Jane Nana Opoku-Agyeman as the first female Vice President of the Republic of Ghana. Mr. Speaker, he made reference to the Affirmative Action and Gender Equity Bill 2024, and that he was committed to working with us. He admitted truthfully that so far his government has appointed 23.8% of women, but he is committed to ensure that he will get to the 30% mark so that we'll get more women to work with in his administration. Mr. Speaker, what do we see here? When we come to the Chamber of Parliament, we have 41 women, 32 women from the NDC side and only 9 from the NPP side. This shows clearly that the NDC administration, led by His Excellency John Dramani Mahama, is more committed to working with women, and I'm a testament of his deeds. Mr. Speaker, on the gender inclusivity bill, he also spoke of the fact that when you come to local governance, we have only a few women who are bold enough to contest for the MMDC positions, and that is not good enough. So the NDC administration is going to work closely with the gender ministry to ensure that we encourage more women into local governance to help them climb up. Mr. Speaker, on the issue of women again, he promised the good people of Ghana, especially the women, to establish the Women Development Bank. And this is a promise he made during campaign, and during the State of the Nation address, His Excellency is committed to making sure that he's going to support women, because most of the time, accessing loan for women is very difficult. But this Women's Bank is coming with loans for women to support our businesses. And I think it's a place where all women around the country should applaud His Excellency John Dramani Mahama. It is so refreshing for most women to hear that we have a vice president and the president is working with her and working with us women to ensure that women are where we are supposed to be. Mr. Speaker, I want to talk on education. His Excellency has made it clear that the NDC administration is not going to cancel the free SHS as is being as our opponents are talking about, but he's going to make sure that he's going to make it better. As we sit in the chamber, members of parliament will attest to the fact that we said the SHS is free in quotes, but when school reopens for the SHS students, most parents come to members of parliament for support. And I believe that with His Excellency John Dramani Mahama, with the reforms that he's going to bring about in the educational sector, will ensure that members of parliament will have some freedom when school reopens. Because most of the time, we have to buy mattresses, we have to buy buckets, provisions, and all other things to support parents for their wards to go to school. I don't blame the parents. They don't have it. That's why they come to us. Mr. Speaker, on health, Agenda 111, His Excellency made us aware that the Agenda 111, none of the hospitals have been completed. Though La General Hospital is not under Agenda 111, what did we see? In the 8th Parliament, they started it, and up till now, it's running at a tortoise pace. So he's committed to bringing healthcare to the doorsteps of the people, and I believe His Excellency John Dramani Mahama and the NDC administration will ensure that these health facilities will be completed. Because when you are sick and you go to hospital, they don't ask you which political party you belong to or which region you come from, but all you need is proper health care. And the NDC administration is committed to bringing proper health care to the doorsteps of the people. Mr. Speaker, on the 24-hour economy, it is a policy by His Excellency John Dramani Mahama that is coming to change the fortunes and gains of the Republic of Ghana. And this is a policy that we have to support. That is, we are going to run 3 shifts and to ensure that those who do not have jobs to do, they'll get jobs to do. Security will be taken care of. Transportation will be taken care of. Where we'll need the Ayalolo buses that were abandoned by our opponents, the NPP administration, when they were in government. The Ayalolo buses are there, and I believe it's going to support the 24-hour economy to make sure that Ghana will come back to life. More people will get jobs to do, and I believe you and we are going to enjoy the gains of the 24-hour economy. Mr. Speaker, I want to thank you for the opportunity to contribute to the State of the Nation address by His Excellency John Dramani Mahama. A truthful State of the Nation he gave us indeed. Thank you, His Excellency.
Thank you very much for not allowing me to even prompt you. Thank you so much. Let's now turn to Honorable Mavis Nkansa Bodu.
Thank you, Mr. Speaker, for the opportunity to contribute to the State of the Nation's address, Mr. Speaker. Mr. Speaker, also let me add my voice